This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome to Mon Health Talk. I'm Dave Wilson. We are going to discuss nutrition this morning. It is Nutrition Month, after all. And our guest this morning is Andrea McCarty, licensed registered dietitian, certified diabetes care education specialist with Mon Health Medical Center. Good morning, Andrea.
Good morning.
Well, thanks for taking a few minutes. We'll dive into the topic at hand here in just a moment. But first, let's get to know a little bit more about you. Where are you from? Your education, training? How'd you end up with Mon Health? All the above, Andrea.
Well, I have spent most of my life, my adult life, in Morgantown. I'm originally from Northeast Kentucky, but I am a WVU grad, and I did do my internship at Marshall, and I have my master's from Rosalind Franklin University in Chicago, and I have been a certified diabetes care and education specialist for 20 years.
So how did you get into that field?
Well, I do have a family history of diabetes, and I also have an interest in helping people deal with chronic disease, which is what diabetes is, and I really want to help patients learn to live a healthy life with a chronic disease, and that's where diabetes came in for me.
So how did you ultimately choose Mon Health?
I am a community health person. I really cherish the opportunity to help members of the community improve their health, and I love that Mon Health is into improving the health of the community. We serve one person at a time because that's exactly what I wanted to do with my career.
I mentioned March is Nutrition Month, so we're going to look at a couple of different aspects of nutrition. But generally speaking, why is the month so important, and why is this a good opportunity to focus in on nutrition?
Well, the National Nutrition Month is the Academy of Nutrition and Dietetics make March the month to focus attention on the importance of making informed food choices and to help individuals develop sound eating and physical activity habits.
You say informed food choices. You emphasize that. Is it we don't make good choices, or maybe we don't know if we're making good or bad choices?
Well, in my experience, and I do work mostly with adults, in my experience, adults know exactly what foods are healthier for them than other foods. It's a matter of how do we choose the healthier foods most of the time, putting that focus on making healthy choices most of the time, but not punishing ourselves if we make an unhealthy choice once in a while.
Why do we not make healthy choices? Let me ask the question that way. Why do we choose the junk food over the healthier alternatives?
There are a lot of reasons. We celebrate with often unhealthy foods. When we're depressed or stressed or bored, we might go more towards the unhealthy foods. And a lot of times we eat what we know, what we were raised with, what we have at home, what we know how to prepare, and those are often unhealthy choices.
Yeah, there's a reason they call it comfort food, right, Andrea?
Exactly.
We're talking to Andrea McCarty, licensed registered dietitian, certified diabetes care and education specialist. So as a registered dietitian, what kind of services do you offer?
As a registered dietitian, registered and licensed in the state of West Virginia, we offer support for patients with chronic disease. Chronic disease could be diabetes or obesity, just as basic examples, also heart disease or chronic kidney disease. We work with the patient to make individualized behavior changes. It's not a one-size-fits-all, such as everyone should do this diet for the same results. It's more helping patients navigate their normal with this chronic disease and helping them to make changes that they can live with.
Yeah, that's a big key, isn't it, Andrea? There are all kinds of different fad diets and crash diets, but what you're talking about is not something you do for 4 weeks or 6 weeks to lose a few pounds. You're talking about really a lifestyle change or lifestyle, just a lifestyle, right?
Right. And that's why we personally, I don't like to say, well, these are your good foods and these are your bad foods. All foods out there fit. And the goal when you're making healthy lifestyle choices with food is to have a healthy relationship with all food. There's not one food that, oh, I shouldn't have eaten that. That's terrible for me. All foods can still fit. There's no good or bad foods here. And navigating that with a chronic disease and understanding how important it is to make healthy choices most of the time, that's where a registered dietitian is going to come in.
Are there different approaches when it comes to diet for type 1 diabetes versus type 2 diabetes?
There are different treatment goals we may have to some degree, depending on the patient. With type 1, many of those patients, losing weight is not high on the priority list, where type 2, for many patients, weight loss may be desired. Also with type 1, they're on insulin from the beginning of the diagnosis, so they may need to be taught how to adjust their insulin doses based on what they're consuming. Whereas for type 2, most individuals at diagnosis with type 2 are not on insulin and may not need insulin for years to come. So we're adjusting diet and physical activity as well as the oral medications they might need to take to manage that condition.
Andrea McCarty is our guest this morning, licensed registered dietitian, certified diabetes care and education specialist at Mon Health Medical Center. We got to squeeze in a quick break. We'll continue our conversation with Andrea right after this. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Andrea McCarty is our guest this morning, licensed registered dietitian and certified diabetes care and education specialist. Andrea, what is the Diabetes Prevention Program?
The Diabetes Prevention Program is a research-based program. It is recognized by the CDC. It's a structured lifestyle change program that, based on the research, was shown with just lifestyle changes, it can reduce someone's risk of developing type 2 diabetes by 58%. But for those over the age of 60, it decreases their risk of developing it by 71%.
So is that something anyone can get involved in, or folks who may be at risk for diabetes can get involved in or should get involved in?
Anybody that qualifies. And to qualify, you have to be 18 years or older. You have to be overweight because one of the focuses is on weight loss. You can't have already been diagnosed with diabetes. Prediabetes, yes. 88 million adults in the country have prediabetes, but only about 20% know they have it. Other things that might make you more likely to qualify for this diabetes prevention program, if you have a history of gestational diabetes or family history of diabetes, you will likely qualify.
As a diabetes diabetes care and education specialist, do you see people who, like you just mentioned, are pre-diabetic or maybe predisposed to it? Do you see folks who already have diabetes? Are you dealing with all the above patients?
All of the above. Now, if we have patients that already have diabetes, they're great candidates for our diabetes education program, and we also offer what's called MNT, or medical nutrition therapy. Those are one-on-one visits with a registered dietitian that are billed to insurance and covered in most cases. It's one-on-one training to set up goals that are specific to someone regarding their nutrition needs. And then we also have, of course, the National Diabetes Prevention Program, and we are currently recruiting for a group that's going to start next week.
Can it seem daunting for someone, and I guess that, Andrea, they don't necessarily have to be diabetic, but since we're talking about it, for someone who's been diagnosed with diabetes and they're facing these lifestyle changes and nutrition changes and diet changes, can that be very daunting, very overwhelming at the beginning?
It is. I mean, I keep a box of tissues in my office for a reason. It's not uncommon for it to be a very emotional situation to deal with a diagnosis of diabetes. I actually have had patients tell me in the past they'd rather be told they have cancer than diabetes because cancer seems like it's treatable. But my job as a diabetes care and education specialist is to reduce that fear, is to help them feel empowered and that they can manage this disease and that actually they have an opportunity to be healthier with diabetes than they were before they were diagnosed.
What have you found leads to successful outcomes when you're working on nutritional changes and shifting to a more nutritional diet, eating more nutritional foods? What have you found is a successful path down that road?
There are a few things that can be signs to me that there's a good chance for success with the patient. And the first has to be willingness to change and being open to learning. Another great way that I can kind of predict if there's going to be success for a patient is if they have support at home or in their friends or work, if there's other people supporting their effort, because if there's someone they're close with or they spend a lot of time with that is not supportive, that usually does not work out well for them.
What are some of the misconceptions you hear about healthy or nutritional foods from your patients?
Oh, I have a long list. One of the common ones is if it tastes bad, it must be healthy for you. That's really, really common. Or one of my pet peeves is when I'm working with an individual and they come in, oh, you're going to be so mad at me because I ate, fill in the blank. Mm-hmm. All foods are fine. All foods will fit. Unhealthy foods can be a part of a healthy diet if they're limited. There are great ways to eat healthy foods that actually do not taste bad. I've tried many of them, but you do have to be willing and open to learn and to try new things. That's for sure.
Well, I think you hit the nail on the head there. Well, obviously you know what you're talking about, but right there, then you have to be willing to try new things. Never thought I would eat. My mind just totally went blank. It's not cucumber. Zucchini spaghetti. Yeah. Never thought I would eat zucchini spaghetti. It's actually pretty good.
Yes, it is. But you, again, have to be willing to try it. Be open to trying new things, and it will be a lot easier for you.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Andrea McCarty is our guest this morning, licensed registered dietitian and certified diabetes care education specialist at Mon Health Medical Center. Andrea, what can eating healthy just do for a patient's overall health?
Well, there's a lot of advantages to eating healthy. For those that have high blood pressure, it could help lower the blood pressure. For those that have high cholesterol, it can help lower cholesterol. For many, it can help with weight loss. A lot of times if you're making the wrong choices, improving your health or making better food choices can give you a boost of energy as well.
We say it, I think, just about every week, and it seems to apply across the board with whatever topic we focus in on. There are three main things to think about. It's diet, exercise, and quit or don't start smoking. So diet's number one there, but Andrea, it can't be done alone. There also has to be, I would imagine, some physical activity, some sort of exercise mixed in there as well to kind of bring it all together, if you will.
Right. The patients that I work with that have conditions where they can benefit from physical activity and they are physically able to be active, they do tend to have the most success if they're incorporating activity into their routine.
All right. So generally speaking, and I know each individual is different, and obviously if they come see you, they're going to get an individual plan, but generally speaking, what kind of advice would you give people to help them eat better and eat healthier?
Learn to have a healthy relationship with food, that all foods are part of a healthy diet. It's a matter of timing and how much you eat. That is usually the bigger problem. So when you have that idea in your mind that you're supposed to clean your plate every time you fill it, maybe work on fixing that idea. Or the other idea, basic thing I would recommend is incorporating produce into the diet. Many of us are lacking that. Where are your fruits and vegetables at each meal?
You mentioned timing. Is it a matter of timing when during the day we eat, or?
Yes, it can be. A lot of times patients will go long stretches of time between two meals during the course of the day, and that can possibly speed up the chance they're going to have diabetes, increase that risk. So we do encourage it, if once you've started eating for the day, eat something every 4 to 5 hours. It tends to benefit you going forward and benefit your metabolism if you're trying to lose weight.
I've heard, and you can tell me if I've heard incorrectly, you're better to eat smaller portions or smaller meals more often than to sit down and go, well, I haven't eaten all day, so I'll eat this I'll use pizza as a reference, but probably a poor example here, Andrea, but you get to gorge yourself in one big sitting, you're better off to eat a little bit more often. Is that true?
It is, but 3 meals a day can be perfectly fine.
Okay.
Some people will try and do 6 small meals a day, and if that works for your schedule, then please do that. But it's not. You don't have to do it. It's not the only way, because there's not one size fits all for the diet.
Is meal planning a good idea?
It usually helps keep us on track to prepare ahead of time or plan ahead of time what our meals will be, and I strongly recommend that right now, when groceries are costing a lot more than normal, is to plan maybe a week in advance what you want to have for your meals coming up and shop accordingly so that there's not as much food waste or as much money wasted on food, because food prices have gone up considerably.
How do you incorporate some of those foods that maybe they're not so good, those comfort foods you were talking about earlier, into your diet so you don't have to give them completely up, but yet they're managed? Does that question make sense?
I think I get what you're asking. Is how can you incorporate those less healthy foods into a healthy diet?
Yes.
Am I getting you right? It's a matter of limiting them. For example, anyone that knows me knows my 2 favorite foods are donuts or buttercream icing. And I am a dietitian, but if I ate those every day, I probably wouldn't love them as much. The buttercream icing is saved for those special occasions where we might have cake with buttercream icing. I don't just go and buy it randomly. And donuts, maybe once every few months, I might treat myself to a donut. But I have to understand that if I've done that for a meal, then I'm going to eat more fruits and vegetables or smaller portions at other meals of the day so that I don't eat more than I should for the day.
Just got a text into the show, 304 Talk 304. Texter says, I've participated in Andrea's classes. She's very knowledgeable and very helpful. So
thank
there's
you.
at least one satisfied customer.
Thank
Andrea.
you.
Hey, how can people reach out if they want to learn more or want to participate in your classes?
They can reach out to me here at Mon Health. It's 304-598-1805. Or there's more information available at monhealth.com as well.
Got about 45 seconds here. What's the one thing you would like people to take away from our conversation today?
Do have a healthy relationship with food. There is no one-size-fits-all diet for any person, and that a registered dietitian can really help you in that path to healthy living through food.
Andrea McCarty, our guest this morning, licensed registered dietitian and certified diabetes care education specialist. Again, if you would like more information or would like to reach out to Andrea, 304-598-1805 is the number. And, of course, you can always get more information over at Mon Health's website, monhealth.com. Andrea, enjoyed the conversation this morning. Thank you so much.
Thank you.